the presentation I'm going to give today is the fellowship that we completed or almost completed. It was an online stroke mini fellowship. That's the name we gave it to it. It was conducted under AAPNA Merit. It was an initiative of AAPNA Merit, like many other initiatives they took started last year, is to how the education or the advanced education can be transferred from US or internationally to Pakistan. So the target for this fellowship were basically either neurology trainees or recent graduates from a neurology training program. We also included in the criteria that medical specialists can apply, or we were thinking that interventional neuroradiologists who are planning to do a fellowship in interventional neuroradiology or who are interventional neuroradiologists may be interested in that. But in the end, the fellowship recruited only neurologists who are recently graduated or the neurologists who are in training. The idea behind that, or the rationale for this fellowship, was that currently there are many neurology training programs, but there is limited stroke trained faculty. So a formal stroke fellowship is difficult to run in Pakistan. And every hospital in Pakistan is admitting about 100 to 200 strokes at least annually. There are hospitals who are admitting many more strokes. But there are many hospitals who are admitting 100 to 200 strokes annually. And they should have some dedicated stroke center that should be run by someone who's trained in stroke. The advisory or the supervisory committee was very, we have very well-known researchers, professors, Dr. Qureshi, Dr. Shoaib Ashfaq, and Dr. Wasim Alamgir from General Wasim Alamgir. He is from, at that time was in PEMH, Rawalpindi. So very well-known faculty or supervisory committee who were helped us in overlooked this program and helped us in devising this program. Course director were myself and Dr. Shahid Rafiq, who is also the co-chair for the AAPNA Merit. And executive committee included Dr. Anjum, who is a Stroke Society president, Dr. Ravi Shankar himself, Dr. Hasnan, Dr. Ismail Khatri, very well known in Pakistan, currently in King Abdulaziz Medical City in KSA. It was actually one of his, this fellowship was originally kind of like planned by Dr. Ismail Khatri, and then later on I took over this fellowship. Dr. Mazhar Badshah and Dr. Mamoona Siddiqui. The course duration was 9 months, and the course was broken down into 12 modules. Each module was 2 to 4 weeks of duration. Each module included 2 to 4 hours of online lectures. And then there were some reading material that was required, and then there was some optional reading material. The required reading material was for 1 to 2 hours estimated reading time, and the optional reading material was included more reference material and can be up to 4 to 8 hours of reading time. Then there were assignments that needed to be completed. They were generally running 4 to 8 hours. Some of the assignments were smaller. And then there was a small quiz after each module for 5 to 10 minutes, questions, 10 to 20 questions. During the 9 months course, we also planned for case conferences. Once per week, it was for almost the first half of the, and there were about 15 to 20 virtual case conferences. Each conference was for about 60 to 75 minutes duration. Some of the cases were presented by the faculty, some of the cases were presented by the trainees. The number of participants, we initially started with 20 participants. Some of the participants were having a hard time, especially because of the COVID and because of responsibilities, other competing responsibilities that they had to kind of like drop out from this program. So we lost about 5 of the trainees, and about 14 or 15 trainees, I think, are finishing. And The prerequisites, as we already mentioned, they should have a neurology background with completed training or training, or they are training in neurology. They can have a medicine or interventional radiology background, but we put it as a prerequisite, but almost all of the candidate or trainees that were included had a neurology background. Either they were trainees or have completed the training. We also proposed a 12-month research track. The idea behind that is that if they can do a 3-month of a research under supervision of a faculty, then they can get a full 12-month of credit. This did not pan out to be, we were not that successful in conducting that. Some of the trainees were able to start the research project. There was a lot of problems because of the COVID, basically, that people were having a hard time. Some of the hospitals were not even admitting the stroke patients when the COVID seasons were high. So unfortunately, we were not that much successful in this initiative. We don't know if we will be able to continue it. The other thing is that initiating the training and initiating the research was taking more time than expected. There was getting the IRB approvals and all the approvals at local hospital was taking more time than was expected. The goals of this fellowship were to enhance the knowledge and expertise of physicians participating in the field of stroke, to develop workforce of neurologists with training in stroke that can guide, supervise, and facilitate stroke care at all levels of healthcare, and to help facilitate the appropriate, ethical, and safe use of thrombolytic therapy, and also kind of like encourage or have the trainees or the knowledge that when to use the thrombolytic, when to use acute medical acute interventions, including thrombectomy, which is gradually becoming more and more available in some of the centers and in Pakistan. So I think it is now important for the trainees to know that there is kind of like this facility, and if the patient is, for example, a young with a large vessel stroke, they need to think about a thrombectomy to facilitate establishment of stroke centers of various levels. So the overall idea is that once we have many neurologists who are trained in a stroke and they start establishing stroke center, then we can move on to having a more standardized care. And I think Dr. Shoaib is going to give a talk about that, about how the SITS registry is being introduced in stroke in Pakistan. So similarly, this program was very closely affiliated with also with interventional neurology training at PMH. Dr. Qureshi is going to talk about that, how that worked out. So overall, I mean, this was multiple initiatives that are being taken in Pakistan with the idea that to advance the care of the stroke and to standardize the care of the stroke. The candidates were asked to write a letter of intent and to submit that letter of intent, then to submit their CV, and then we looked into what is their medical background and expected utilization of this course. So they have to mention that what they want to do or what do they want to achieve after undergoing this course. It was a pretty simple process. This was the first year. We are expecting more candidates for the next year, so maybe the process we will have a more somewhat more rigorous selection criteria for the upcoming year. The program structure included basically online lectures was the key thing. The lectures were recorded. It were didactic sessions. And I'm going to give the details of what were the modules and who were the faculty. But that was the main lectures were recorded. After listening to the lectures, there was a quiz that the trainee has to undergo the quiz. Before that, they have to also go over some reading material, which was required. And then there may be some optional reading material. And then there was a task also. There is some kind of like, either they have to kind of, for example, draw the brainstem strokes or write about how they can improve, for example, their local hospital, what can they bring in as a stroke center in their local hospital. So different tasks. We initially thought about a podcast, but we did not have any for this course. There were, as we discussed, there were some discussion. We had some discussion board where we were encouraged the trainees to post in some cases. There were few, but if the trainee is undergoing some complex case decision, they would post it on the WhatsApp board group, and then we will discuss about what would be the appropriate management. And then we had a case discussion in virtual meeting, as I mentioned before. The core curriculum, I am not going to go over the whole thing. The core curriculum basically included each and everything that we can think about ischemic stroke or ischemic stroke, intracerebral hemorrhage, or subarachnoid hemorrhage. So anything from acute care, etiology, pathology, pathophysiology, imaging modalities, management, and rehabilitation, and critical care, everything that can we think of, we try to put it in there. We may not have gone into very extreme details about each and everything, but try to cover it in a very comprehensive fashion. Nevertheless, these were the modules. These are 12 modules. Each module, as you see, that the course started on October 5th in 2020 and finished on July 21st. Was supposed to finish on July 21st. The last module started on June 7th. And but because of the some COVID wave, we extended it to the end of the August. These are the each module you can see is about 2 to 4 weeks. There was 1 week of a break. For the upcoming year, we will probably give more break. And each module was kind of like they were planned, so they are kind of like linked to each other in some way and progressing in some way. The faculty, this is myself. I did participate in 4 or 5 of the modules. Dr. Tamoor, Ali Nomani, Adil Malik from John Hopkins, and Saqib Chaudhary, Ahmed Qureshi. So we have a faculty. Ahmed is in Riyadh, and Dr. Abbas Karal in Cleveland Clinic, Dr. Shahid Rafiq, who was also the course co-director, Dr. Ismail Khatri, he was in Riyadh, Maria Khan Junaidi in Dubai, so Hasnan Ahmed from Hashim from Faji Foundation. So the faculty was not only from US, but from all over, was international faculty. And they were very dedicated and very enthusiastic about with the course, and I think all of them did a good job. The stroke course started was for the upcoming stroke course, we are anticipating we started in the first week of January. This time we are thinking about we prolong it to 10 months because we realized some of the modules were a little bit tightly packed. We were going to change some of the duration of some of the modules, increase some of them, and reduce, for example, the rehabilitation modules. We are going to reduce those and maybe include some longer break in between. Then we will start accepting the applications right now. And this time we will put a fee of 500, and we'll open it to the international candidates also, not only to the Pakistani candidates. Initially, we are going to obviously take Pakistani candidates and then open it to the other candidates. There will be a graduation ceremony at Rawalpindi Medical University on December 21st, and introduction, and it will also include introduction and welcome for the upcoming batch. So we will, after the candidates will be selected, we will invite them and also discuss with them what we are planning to do for the next year. Thank you.